The coronavirus has led to another spiraling crisis across the U.S. and here in Alabama. Doctors and advocates for victims are seeing signs of an increase in violence at home. They're hearing more accounts of people lashing out, particularly at women and children. Adde Waggoner with Crisis Services of North Alabama joins us now to talk more about the issue. Thank you so much for being with us tonight.
Thank you so much for having me.
The number of people seeking help from domestic violence has increased significantly in recent weeks. How big of an impact are we seeing here locally during the coronavirus pandemic?
So we have seen a significant increase across specifically April and May. We would estimate it upwards of a 25% increase over those 2 months.
What is contributing to the increase?
For the large part, it is the isolation. So right now, especially throughout the pandemic, abusers are quarantined with their victims. They weren't going to work as often. Perhaps they're not going to school, not going out to the grocery store or other errands where they can kind of get away from their abuser. But instead, they've been quarantined and isolated without, contact to the outside world. So they haven't really had those opportunities to perhaps escape or call 911 or call for services elsewhere.
And what has been the impact on social services for domestic violence victims during the pandemic?
Well, the impacts have been kind of twofold. We operate, of course, at capacity with often a skeleton crew of people. People's kids are home and they have to take care of them as well. But it's also been kind of on a national level of delayed funding, and perhaps people that normally would donate funds to organizations such as ours, they weren't able to afford those. So we've seen a slight decrease in funding, but on the other hand, we've seen increases in organizations across the Tennessee Valley that have really stepped up to provide additional assistance to organizations such as ours. So I don't feel like we suffer, but it's definitely been a shift in how we are thinking.
How is the coronavirus pandemic likely to affect long-term progress towards ending domestic violence?
That is an excellent question. Well, as most industries in the country have had to pivot, and I'm sure people are tired of that word, we've also had to pivot in how we attempt to reach populations that may be underserved or experience a higher risk of domestic violence. But we're adapting. We have a video series in the works that we're trying to publish on our website and through our YouTube so that perhaps we can reach that one or two people that may see that and choose to reach out to get some assistance.
What can people do to help?
Reach out safely if you can. If you feel like a child is in danger, please call DHR and call in a welfare check if you can, if you feel like that's a viable option. It can be sticky on reaching out to an adult because they are in close quarters with their abuser, and often that abuser has passwords to phones, so if they see a text message that may be suspicious, that could cause problems. So what you can do is make yourself available as a trusted friend in kind of an ambiguous way. You can have a safety plan at hand, which those are available on the Domestic Violence Hotline website. And if you get the chance to talk with that person on the phone, go, hey, we got a minute, let's safety plan together and make sure that you stay safe. And if you don't feel comfortable with that or you're not sure how to proceed, call the hotline. Here in Huntsville, we have the 24-hour helpline, which is 256-716-1000. And we also have a text line in the evening from 4 to 11:30 p.m., and the number for that is 256-722-8219. And we will be happy to talk you through safety planning and what steps you can take to help keep a friend or a loved one safe.
Adde Waggoner with Crisis Services of North Alabama, thank you so much for your time tonight.
Thank you so much for having me.